Hello, friends, and welcome back to our channel. We're going to discuss dementia today, a condition that affects millions of people globally. We'll discuss dementia's definition, kinds, symptoms, and effects on day-to-day functioning today. A deterioration in cognitive ability that causes problems in day-to-day living is referred to as dementia in general. Dementia risk does rise with age, but it's not a typical aspect of aging. This video is for you if you're wanting to know more about it or if you have a loved one who is going through it. So let's get started. What is dementia? A variety of brain-damaging neurological disorders that impair cognitive function are together referred to as dementia. It so impacts thinking, memory, behavior, and the capacity to carry out daily tasks. It's crucial to understand that dementia is not a single illness, but rather a syndrome brought on by several illnesses or conditions. Dementia is also not a typical aspect of aging, even if the risk rises with age. Let's talk about types of dementia and their symptoms. Number 1, Alzheimer's disease. This form is the most prevalent, making up 60–80% of cases. It is characterized by a progressive decline in thinking, reasoning, and memory abilities, as well as the presence of amyloid plaques and neurofibrillary tangles in the brain. Symptoms include memory loss, particularly with regard to recent events, planning and problem-solving difficulties, perplexity regarding location and time, difficulty in doing routine tasks, mood and personality changes. Number 2, vascular dementia. It is the second most typical kind. It is brought on by decreased blood supply to the brain, frequently as a result of small vessel disease or strokes. Brain cell death is caused by damage to blood vessels. Symptoms include issues with judgment and planning, uncontrollably sobbing or laughing, a reduction in focus and cognitive function, challenges with equilibrium and gait. Number 3, Lewy Body Dementia. It is linked with abnormal protein deposits in the brain known as Lewy bodies. Symptoms include visual hallucinations, Parkinson-like movement abnormalities, e.g. rigidity, tremors, disturbances in sleep, variations in attentiveness and focus. Number 4, Frontotemporal Dementia, FTD. It mostly affects the brain's frontal and temporal lobes, causes alterations in language, behavior, and personality. Symptoms include notable alterations in social behavior and personality, a decrease in empathy and improper behavior in public, difficulties with language, such as naming, speaking, and understanding, repetitive or compulsive actions. A word of caution. Remember, this video is for informational purposes only. If you have concerns, talk to your doctor. They can advise you on the best screening methods for your individual situation, especially if you have any underlying health conditions or are on medication. If you like what you've seen thus far, please click the like and subscribe buttons and the bell notification. Thank you for viewing. While dementia symptoms can vary greatly, frequent indicators include mood or behavioral changes, confusion, memory loss, and trouble speaking. These symptoms may start out mildly and get worse with time. A patient's medical history, physical examination, neurological testing, and even brain imaging are all used to diagnose dementia. Since numerous disorders can mirror the symptoms of dementia, a thorough examination is necessary to achieve an accurate diagnosis. The majority of dementias have no known cure, although there are therapies that can help control symptoms and enhance quality of life. Diagnosing dementia. While there are several potential causes of dementia, the main risk factor is getting older. But it's not a typical aspect of growing older. Another factor is genetics, particularly in cases with an early beginning. Cardiovascular problems, diabetes, smoking, and a sedentary lifestyle are other risk factors. We have no control over certain risk factors such as age and heredity, but we do have influence over others. Reducing the risk can be achieved by controlling chronic health issues, leading a healthy lifestyle, and engaging in mental activities. Living with dementia can be difficult for the affected individual, as well as their family members and carers. It is imperative to provide supportive care, which might include therapy, medical attention, and useful assistance with everyday tasks. Support groups and specialized care facilities are just two of the many resources that can offer much-needed help and emotional support. It's critical to ask for assistance when you need it. Treatment and management. Although there isn't a cure for dementia at this time, there are therapies that can help control symptoms and enhance quality of life. Certain symptoms, such as mood swings or memory loss, can be treated with medication. Moreover, Interventions like occupational therapy and cognitive stimulation may be helpful. Scientists are always conducting research to gain a deeper understanding of dementia and to create novel therapies. Clinical studies give promise for further developments in the future. Dementia needs patience, understanding, and empathy on the part of the person providing support. Learn as much as you can about the illness, be honest with others, and establish a welcoming environment. Never forget that even tiny acts of compassion and understanding can have a significant impact. If you're concerned that you or someone you know may have dementia, it's important to see a doctor for diagnosis and treatment. Early diagnosis and intervention can help people with dementia live longer, fuller lives. Dementia is a complex condition, but with the right knowledge and support, it's possible to navigate the challenges it brings. If you found this video helpful, please give it a thumbs up, share it with others, and subscribe to our channel for more informative content. And if you have any questions or topics you'd like us to cover, let us know in the comments below.